Hi, my name is Ben, and welcome to our first Inspire podcast. In this episode, we're going to be talking about and discussing the link with alcohol and mental health, the warning signs, what changes you can do, and much more. I do, however, have to apologise that the quality of the recording is not the greatest, as you can appreciate that we are currently in the pandemic and having to do it over Zoom is probably not the best. So this will be noted for next time we do our next podcast. So there will be a few email pings. I can only apologise for that now, but keep listening. It's well worth the listen.
So first things first is to do some introductions. Don't worry, guys, we're not in a meeting, so there's no icebreakers needed. Or you need to tell me something interesting about yourself that we don't know. So first things first, if we could just go to you, John. Who are you? Who is John? What do you do? And how long have you been working for the service for?
Hi, my name's John Robinson. I'm a district manager for CGL Inspire in East Lancs, district manager for Highbury and Rossendale, and also detox lead for the East Lancs service. I've been working for Inspire for 9 years now.
Wow, 9 years.
Time flies.
What about, Andy Lane, Dr. Andy Lane, sorry.
That's all right, Andy Lane's fine. Thanks, Ben. I'm Andy Lane. I'm the clinical lead for Inspire East Lancashire. I've worked throughout most of Lancashire in substance misuse. Started in the year 2000 and have spent the past 10 years with CGL Inspire in North Lancashire and in East Lancashire.
Brilliant, spot on. Dr. Abhi Goli.
Hello, my name is Abhi Goli. I'm the regional lead consultant working for Inspire Change Grow Live. I've been working with the organization for the past 5 years. My main role is to oversee clinical services as well as smooth running of all the services clinically and providing that clinical leadership across the Lancashire footprint. You're the person, I'm the person you need for any issues you have or problems.
Thank you, Abhi. Okay, so why are we here today? Why are we starting this podcast? Really is really because it's Alcohol Awareness Week 2020. So when is Alcohol Awareness Week? Well, Alcohol Awareness Week is commencing 16th of November. And this year's theme is around alcohol and mental health. So in this podcast, we hope to be discussing the link between alcohol and mental health and the best ways to look after ourselves and those we love during a year of great change and uncertainty, which is probably the understatement of the year. Just a little statement here is around 1 in 4 people in the UK experience a mental health problem each year, and drinking too much or too often can increase our risk. But many of us are unaware of the link between alcohol and poor mental health, and it's often the first thing we turn to when we're feeling low, stressed, worried, or unable to cope. Yet drinking too much or too often can mask or enhance underlying mental health problems, such as anxiety and depression, and prevent them from being properly addressed. So I guess as a start for us to discuss further is around the link of alcohol and mental health. You know, I'd like to think, you know, I'm your Joe average guy, or at least I think I am. I've just finished work. A cold, crisp beer is waiting for me in the fridge, and before you know it, I've managed quite a few more. Does this affect my mental health when I am doing that sort of stuff and I'm going, you know, just having a couple of drinks? Or and I guess the part of this question is why are people affected differently by alcohol?
Shall we just look at what happens when you have that first drink, Ben?
Let's go ahead.
Try and keep it really straightforward. We all know that when you have, this is if you do drink alcohol, the first 2 or 3 drinks put you into a very happy, somewhat relaxed, almost euphoric mood. Life is great. Now, in your brain, there are three, we call them hormones for convenience. One of them which excites you, one of them which depresses you, and one of them says, to hell with it, I'm going to do that again. Okay? So you have a few drinks early in the evening, and that hormone that is exciting the brain is triggered. And you feel pretty good. However, you then have a couple of other drinks, and the hormone that depresses you kicks in and overrides that exciting hormone. So you start to become intoxicated. And with that, you become sedated. And then blow me down if another hormone doesn't kick in that says, hey, this is all right, I'll do it again. This is what happens very simply in the brain. And some people find it difficult to stop, and the do it again hormone kicks in and they become quite intoxicated. And those people that have experienced a hangover know that it is not a happy time. It is the most depressing time. Alcohol essentially is a depressing drug. Only when you have a small amount early on in the drinking phase that it actually causes excitement, if that makes sense.
I've never really thought about the mechanics of how that actually happens when you drink.
But if you think about having your cold lager tonight, and for some reason you're so stressed, initially it's brilliant. Then you become quite morose and start thinking things that maybe aren't appropriate. Then what happens is you fall asleep. But that's not fatigue sleep, that's drug-induced sleep. You wake up a few hours later feeling pretty rubbish. And I think that whole episode, when repeated, is a depressing behavior. And there are some people that find they have to continue doing that.
So that kind of leads to the next question. So why do people then, if that's how they feel in the morning or the day after, why do they continue to do that? Is that because they are addicted at that stage, or?
Some people will need a drink in the morning, hair of the dog. Yeah. And what that does is it replaces the alcohol that they are missing and keeps the body in an alcohol phase, which they quite enjoy because it stops them withdrawing. That's not that common, let's be honest.
No.
It's more of the routine that I think we're seeing during COVID times, where I have to say pressures are on and working practices are very different. And alcohol, I think, in more people than I would care to name a number, is becoming a release at tea time, just as you said earlier on. And I think that habit of behavior, the longer this sort of situation continues, is going to put some people at risk.
So you think it's like a routine then as well? Like people just, it's I come home from work, I open the bottle of wine, and before you know it starts becoming that is the routine.
My father-in-law used to have 5 pints every night on the way home from the pit. And we never considered it a problem. And then Sunday lunchtime, he put his Sunday best on and went to the pub. This was his routine. I'm sure he had liver damage and everything else to go with it, but we didn't look for it, just what people did. We know more about it now.
And do you think we're in lockdown now, that these are quite a common theme now that we are starting to see, and the statistics show that people are buying more alcohol?
I think if you talk to people through WhatsApp and what have you, the majority of my family, and I'm part of quite a big family, we talk fairly frequently, and most of my siblings seem to be having a glass of wine when we talk in the evening. That wasn't behaviour maybe 2 years ago.
Yeah, I think it. People most people drink alcohol for the effects rather than the taste, don't they? And we know a lot of people drink alcohol to medicate low mood, anxiety, boredom, things like that. And I think the increase in alcohol use is probably directly linked to people's emotional response to the current pandemic.
Yeah, no, that's good. Okay, so we kind of like spoke about how the body reacts and discussed a little bit about the link with mental health. What impact can the longer term drinking have on our mental health then?
Well, perhaps I could join in for something like that. Andy Lane, Dr. Lane previously spoke about alcohol being a depressant. So I think that's kind of the start of one's mental well-being being affected, perhaps. It can affect in various ways, but one of the things it does definitely have an impact on is our neurochemicals, as we call the hormones, which it can alter and cause an imbalance. And possibly that's the start when you start to feel a bit rough, feel a bit down, feel a bit anxious to begin with. Obviously, there are much more complex things alcohol can do to our mental health and to our brain. But that's something I think people should start watching for before it becomes a bigger problem.
Ben, I've just got some stats here you might be interested in. So,
Yeah.
This English hospitals, going back a couple of years, there's 200,000 admissions for mental and behavioural disorders due to alcohol use. So that's about 20% of all hospital admissions for alcohol were linked to mental health.
Wow.
Another data set is 86% of people with an alcohol problem accessing drug treatment services have a co-occurring mental health problem. And 44% of community mental health patients also have either a drug or alcohol problem. So we're seeing that significant numbers of dual diagnosis, not just in drug services, but also in mental health services.
And sorry, did you say that was pre-COVID, or is that now? These days? This is what? Sorry.
That was pre-COVID.
Right. Okay. So we can presume that the numbers will be
Higher
and spiking much more than that. How much is too much alcohol? So we do say we do come home from I don't know, we've had a hard shift at work, and we just want to take the edge off by having a glass of wine or a beer in the fridge. But is that okay, or should we be? Is there a structure in place that we should really be following?
Up in South England, I understand, recommend 14 units a week for both males and females. Now, the average bottle of wine has 10 units. So you're probably drinking a bottle and a third and a bottle and a half of wine a week. Now, that's recommended safe limits. I suspect, and this isn't my opinion, but I suspect a lot of people will say that actually it's safe to drink considerably more than that. And there are a number of people who would probably drink that amount every evening of the week, either in the form of beer, wine, or spirits, and function quite normally the next day at work for years on end. However, we do know that sort of behaviour on a regular basis over a period of time will cause some physical damage. And so then we get into the problems with liver disease, with abdominal problems, with stomach ulceration, with bleeding. And we're seeing more and more of that now in an older population who are still drinking, because we're actually keeping them alive from a medical point of view. Hepatology, the liver department in the local hospitals are seeing a lot more significant liver disease, as we are in the people that are coming to us for alcohol-related dependence.
One of the big changes I've noticed in the last sort of possibly 18 months to 2 years is a huge increase in severe alcohol dependency at the lower age end of the spectrum, possibly under 30s and under 25s. Historically, we'd see more sort of recreational drug use in that age group, but we've seen a lot more alcohol dependency and a lot more some of the sort of long-term effects of alcohol consumption we're seeing in the under 30s and under 25s really sort of damage livers and stuff like that. And we're also starting to see a lot of people from the older adult group presenting for support with alcohol, people in the 65, 70, 75, 80 age group category who've never been in treatment before, who's possibly been drinking at a certain level for a number of years, but unfortunately their physical health now deteriorating because of that long-term alcohol consumption.
I think then if you add on the effects of significant long-term physical disabilities due to alcohol, that actually isn't a happy place to be. And so we then end up going back onto the problems with mental health as a result of significant physical health, the limitations on mobility, the limitations on social life. They're happy to do this, the support that's needed. That's not a very happy place to be, and I think that in itself is very depressing. The other thing we see not uncommonly is people who are depressed and are maybe alcohol dependent or are binge drinkers can actually cause themselves an awful lot of physical damage when intoxicated. And that's directly as a result of the alcohol taking away the inhibitions that allows them to feel their true mood swings, and quite serious consequences can come of that.
I think what we might have to think about is why there is a reason why there are recommended limits. And I think government had to review the recommended limits not so long ago and making it equal for all genders. And there is a reason for that. And I know that the other two guys have touched upon it. And it's, I think, the wider impact. And I think the more exposed we are to those harmful levels of alcohol intake, the higher the risks on our mental health and the higher the impact of causing more damage to our body's physical health and the mental health. And I think it's also important to bear in mind that the physical health may not always seem obvious on the upfront. People can go undiagnosed or may not pick up the subtle things with alcohol related damage. And I think sometimes it becomes a bit too late when we see the more long term and the harmful effects or the permanent damage caused by alcohol.
I think as well that the weekly limit, 14 units, it doesn't just say finish work on a Friday and go through your full 14 units on a Friday. It's best
that was my next question.
Spread the units out across about 3 days, really, rather than sort of binging on the full 14 units.
All right, okay, yeah, because I was going to ask that question. There might be a lot of people out there saying, well, I've not had, I can store my points. It's a bit like Slimming World or something like that. I can save me points or something. I didn't know whether the same applies in that respect as well. So do you think the 14 units is something that we that you would say is correct? I mean, does this the body mass make a difference? Does alcohol affect women more than men? Is that a genuine question, or is it?
I think maybe the fact that they put the numbers down to equal units for men and women would suggest that the risks of alcohol for both sexes is pretty much identical. Okay. Previously, we men were permitted to drink more than the woman, and when that was the case, there was a lot of publicity about groups of women going out in the evening and drinking copious amounts of alcohol and becoming very intoxicated. There wasn't the same high press profile for the men doing exactly the same. So I suspect the damage is going to be done in either sex. I mean, historically, it's been the big, strong male who's been able to down a few pints. I suspect that that's practice. And we know that if somebody drinks 3 or 4 pints a night, every night of the week for the right effect, that effect won't be as great. And after a period of time, those 3 or 4 pints will need to be 5 or 6 pints to get the same effect. And I suspect then when we meet these guys that can drink us under the table, they actually practice a lot more and possibly have a degree of dependence as a result of that. And this is a pattern we do see, and that is part clinically based. So the people that I suspect have to go to bed at midnight are the ones that maybe don't drink during the week. So the alcohol is quite effective. Those that maybe go out every night and have a couple of pints, they're going to need a lot more on the Friday and Saturday night to have the effect that they want. And this is one of the ways that a dependence to alcohol comes on board, and then with all the mental and physical problems as a result of that.
Okay. I mean, there might be some people who might listen to this and say, well, I only drink on the weekends. Can that affect their mental health as well?
There was some interesting research, and I can't for the life of me remember where I read it. That's as sad I am, but there was some research said that the absenteeism of 18 to 28-year-olds was highest on a Monday from employment. Now, this was directly related to the amount of drinking and on occasions other substances that were used over the weekend. So they binge drank all weekend, run for work on Monday, and this was a pattern of behaviour. Scotland, I know, had a lot of research on the significant problems with health on a Monday after the weekend binging. So there is evidence out there that heavy drinking over a weekend, especially if you include cocaine and some other substances that are very popular in that particular age group, does cause problems.
I think it might be worth having a sort of conversation about the risks of alcohol and cocaine and cocoethylene in the body. A really toxic compound, isn't it?
It's very toxic, highly addictive, and the people that do it can't stop until they've no cocaine and no alcohol left. And that absolutely, I mean, they're awake for 24, 48 hours on some occasions. Who's going to go to work on a Monday morning after that? And the financial impact of that on the country as a whole and on individual and the family, quite considerable. And that brings on the whole knock-on effect of alcohol in the individual and the alcohol effects to the rest of their family, siblings, etc.
Okay, Not to forget the impact on the heart. I mean, even younger age group tend to have healthier heart functions, but obviously this combination is going to really start impacting on their well-being. And in some people, I've seen their lifespan being reduced as a result.
So we've spoken, on the link between alcohol and mental health, some of the physical effects as well. So I want to make some changes. What's the next steps on this? How do I go about making some changes?
I think it's always important to look at taking some really small steps to begin with. I think first of all, recognizing what is the recommended limits and what is harmful, as we've discussed earlier. And I think it's first of all recognizing that and understanding its wider impact on one's well-being, physical, mental health, and their social life as well, financially as well. And I think that the next step would be around looking at changes. Changes could be around reductions, changes could be around the amount of alcohol intake one consumes, or even choosing the right percentage of alcohol to equate it to the units what's recommended.
I mean, there's loads of there's a lot of these what you call it, low alcohol and no alcohol drinks really emerging onto the scene now. I don't know if you guys have seen them now, but you used to go to a bar and the barman would look at you quite peculiar, asking for a 0% alcohol. But you see a lot more now being stocked up in the bars and in some of the pubs, and sometimes just sometimes I just like to just go and maybe just asking for one. It's just being in that, being in the pub and just being, social with your friends.
It's interesting that the number of people who get involved with Dry October or Dry January, and with the greatest respect, those that can complete it haven't got an issue. But those that would be fearful and struggle with it, I think, need to address these problems. And I think that when we listen to family and friends who maybe would make a comment, and oh, you were a bit the worse for wear last night, or do you think you should be driving this morning, or various other things, when it starts to impact and you're getting feedback, I think it's time to reassess the whole situation. The problem then arises if you find it difficult maybe to not drink on school nights. Then there are little messages that would suggest that possibly you are developing a problem, and maybe that's when you accept the fact that there is one, and if you're in the right frame of mind, do something about it. And I guess that's the start of where we become involved with the management of individuals who, without their knowledge, maybe are struggling to not drink.
I think some of the simplest steps you can take if you're at that stage is to possibly increase the number of days when you don't have a drink, and possibly on the days that you do drink, to maybe alternate rather than having a pint and another pint, have a soft drink in between the next alcoholic drink, and try to space it out like that. And then you will start to sort of see how much of a struggle it really is for you to sort of make them changes. And that will sort of give you an indication of just what sort of relationship you have with alcohol. Some people might find that pretty easy to do, some people may not.
It's almost like taking control, isn't it? And it's also about learning to say no, or when to say no. It's often more challenging and trickier, but it's about us retraining our brain, retraining our way we look at things, and when to say no.
The problem we've got is that we are in a society which has a drinking culture, and I'm always amazed when there is a bereavement, and before the COVID time, the funeral parlours, they had a wake, and the wake basically involved drinking copious amounts of alcohol, which made everybody incredibly depressed and didn't do anything for the mood of the occasion. We then do the complete opposite when a child is born, and we wet the baby's head. Essentially, that means that we drink more alcohol to celebrate the birth of a child. Now, this sort of culture seems to me to be pretty entrenched in the way we are, but I haven't seen much evidence of it changing. And I just find that if that's happening still, maybe we need some major changes of thought. I mean, it's all toasting this and toasting that. It's just such a way of life.
So for anyone who maybe suffer from depression, and alcohol is their way forward and their solution, what can they do instead of reaching for that bottle? Is there anything else that they could be doing instead of to improve their mental health and well-being?
As I said earlier, it's first of all around recognizing that alcohol makes people more depressed, and commonsensically, once we start to withdraw what is causing depression in the first place, automatically their moods are likely to lift. And I think I often have advice to people who I see in clinics and stuff is first thing around looking at what are the pleasurable activities, what are the things they could be looking at to replace their drinking behaviors, for example. What else can they do instead? There could be different simple techniques people could do, is around reminders on the walls or somewhere to do things differently. I remember when I was training up, talking to nurses and other clinicians is also about replacing parts of alcohol with other drinks which could be non-alcohol based. So that could be a good start to then look at that. I mean, the reason I talked about the pleasurable activities is, again, lifting your spirits, lifting your mood, making you feel a bit more happier, more content. Being around like-minded people would be something which really makes a big difference around people suffering with depression.
Yeah. So I'll ask you guys on the panel, what sort of things do you do to keep your mental health in check? Have you got any kind of tips that you do, or you could suggest to anyone who's listening? I mean, for me, sometimes it's about structure. It's about having that shower in the morning. I know now a lot of the times we're working from home. Sometimes you can just roll out of bed at 5 to 9 and just flick your laptop on and turn your camera off and say it's broken. You can do all that sort of thing, but you feel sluggish and it can put you in a bit of a crappy mood. So I think for me, as a way of improving my mental health, especially through the lockdown, is to just have that structure, make your bed and have a wash, get clean, dress smartly. It's the way that I kind of deal with things. I just wonder if you guys have got anything that you could add in terms of improving your mental health and under the circumstances that we're in at the moment.
I think certainly not spending too much time on your own and reaching out and connecting with friends and families is equally important. There's been a big campaigns, hasn't it, over the last sort of year or so about men reaching out and men challenging the stigma of mental health and overcoming that by getting out there and being more open. So certainly challenging social isolation and reaching out is a big part of managing your own well-being. Exercise and getting outside a bit more and stuff like that.
Yeah. Loneliness is often cited as a reason for people drinking. And the other one is boredom. And alcohol, when intoxicated, helps the day pass very quickly from getting up in the morning to going to bed at night. And the number of the service users I see in clinic time will say that they're all right if they've got something to do. So I don't think it matters what you do as long as you're kept busy. Given the COVID times, being busy is very different to what it used to be. But I think it's a matter of making yourself busy. And certainly we have a number of colleagues within CGL Inspire whose role it is to keep people busy. These activities are still going on despite the lockdown, using various virtual methods, and they have been accepted very well. And if somebody's got a meeting at 3 o'clock in the afternoon, they're unlikely to have a bottle of wine with their lunch. And so there are very simple things that we're still doing to maintain it. I personally like to get on my motorbike, but that's probably not the healthiest of sports.
I mean, I tend to go for a run. That really keeps me going. Having some really comfort food really helps me. I end up cooking for everybody, and having that family time really lifts your spirits even after having a really stressful day at work.
I think the key message is being not exercise, but being active. Just being active, being busy.
Yeah, that seems to be the theme, doesn't it? Keeping your brain like ticking over, doing things, meeting, socializing, connecting. It seems like a very common thing to keep your mind at check and stuff. So no, really good answers there.
And the more things you do that you like, the body will produce the endorphins, isn't it? Which is the body's sort of You know, when we talk to service users who got alcohol problems or alcohol dependencies, they often describe alcohol as being their sort of best friend at some point.
Yeah.
It eventually turned out to be their sort of arch enemy. And when we talk to the families of people who have alcohol problems, the partners, the wives often think that the relationship with the bottle is like them having another partner that's just totally cut off from any relationships because of the alcohol.
Yeah.
So connecting with other people is definitely a big part of the behaviour change to make when moving away from alcohol. And one of the common patterns that we see, people may step away from the pub or they may cut themselves off from other people that are drinking, but they don't replace that with other people who aren't drinking. They'll go from one social network to isolation rather than going from a negative social network to a positive.
That's good. So you'll be happy to know it's my last question from myself, which I found another interesting stat, which I'll just read. And it's kind of linking into the stat that you brought forward as well, John, earlier. So in England, there are an estimated 586,780 dependent drinkers, but only 18% are receiving treatment. So with that statistic, what do you think needs to happen to make a change? And what do you think people listening to this should do or try and think about?
We know in Lancashire there's probably about, I think at the last time we had a discussion, there was a couple of thousand, possibly 3,000 dependent drinkers in Lancashire who are not yet in treatment. So I think ultimately it's about reducing the stigmas associated with having an alcohol problem. I think it's about strengthening our connections with other healthcare providers, GPs, hospitals, but also I think there's a lot of work to be done with employers. I think people are frightened of coming into treatment in case they might lose their job, or certainly mothers might be frightened of coming into treatment because they might lose their children. And I think we just need to get our message out there that we're here to help people sort of sustain their lives and overcome their problems and keep their jobs, and also to keep their families together. I think there's still a lot of stigma associated coming into drug treatment services for them sort of groups.
I think sometimes the impression we have of somebody who is alcohol dependent is somebody who's unemployed and hasn't really got very much social status. That's quite often the people we see. I think the majority of people who are actually alcohol dependent are probably not aware of it in full-time employment and drink on a regular basis in the evening. And sometimes this comes to light when maybe they get stopped in the morning for a driving offence, or they nip out to get the takeaway mid-evening, and suddenly the realisation that they've actually got a problem hits home. But I think that's as John was saying, that's the population I feel that are actually fairly prosperous. They can afford it. They've got a house, they've got a family, but they're the ones that I think are most at risk.
And that's what we're seeing in the sort of older adult population. People who have had affluent lifestyles, they've had employment, they've reached retirement or redundancy or whatever it is, and their alcohol consumption has increased in retirement. They come to us and very treatment naive, never accessed any support before, but their body has been subjected to possibly 20, 30 years of regular alcohol consumption.
I think COVID has definitely taught us that we need to do things differently. So, for example, previously, I believe one of the big barriers for people wanting to come into treatment was being associated with an alcohol service, stigma around that. But I think we can move away nicely from that. People don't have to come to our buildings. We can go to them. We can look at things. We can work with their doctors to support those individuals. and yet still give them all the help they need to get them off the alcohol, if that is the main problem. And I think that's something to bear in mind, really.
Thanks very much. I've really enjoyed that, and some of the input, some of the answers that you've given, some of those really important questions. So thanks really much for coming into this podcast, and hopefully our listeners will be able to give us some comments and some feedback, and let us know what you thought of the podcast as well. It'll be going on to all our social media channels, and we will be providing some links, numbers and support should you need them, from over the topics that we've discussed in this. So until next time, thank you very much for listening.
If any of the topics that we have discussed in this podcast have affected you in any way, please make contact with Inspire, either on 01254 495 382. Check us out on our Facebook page, which is Inspire East Lancs, or head over to our website, which is inspirelancs.org.uk. I strongly suggest checking out the Alcohol Awareness Week website, which is alcoholchange.co.uk. On there you'll find lots of resources, tips, useful apps, a quiz where you can find out whether you're drinking too much, and also some good hot tips around alcohol and mental health. Hope this has been useful for you.